Welcome everyone to our lecture on the prevention of common diseases in children. Module 6, Nutrition, Hygiene, Exercise, and Mental Health. I'm Dr. Pauline Del Mundo. So malnutrition is defined by the World Health Organization as deficiencies, excesses, or imbalance in a person's intake of energy and or nutrients. There are three broad categories of malnutrition, namely undernutrition, stunting, underweight, and wasting, overnutrition, including underweight and obesity, and micronutrient-related malnutrition, which involves iron deficiency, anemia, etc. Malnutrition has to be detected and treated and prevented to avoid potentially irreversible health effects later in life. Malnourished individuals are more prone to infections, they're more prone to lifestyle illnesses, and they have poorer performance in school and work. Interventions like regular height and weight measurement, school feeding, and vitamin supplementation are important in screening and managing malnutrition in the community and schools. So how do we define undernutrition? So as we said a while ago, we have the classifications for undernutrition like stunting, underweight, and wasting. Stunting is defined as having low height for age, underweight is low weight for age, and wasting is low weight for height. So these children who have such statistics are undernourished if they fall below 2 standard deviations from the reference of their age. On the other hand, if you have overnutrition, such as overweight or obesity, the children would have a body mass index or BMI of above 2 standard deviations for their age. The Department of Education has a program called WASH, which stands for Water, Hygiene, and Sanitation in Schools, and it's also known as WINS. It's a comprehensive program that offers several levels of intervention, such as facility improvement, administrative programs and behaviors, health education, and providing commodities like kits and toothbrushes for hygiene and sanitation. So WINS can be leveled up during our school reopening through promoting behaviors that prevent infection, such as hand washing, limiting the sharing of personal items, and the proper use of disinfectants. In the context of a pandemic and school reopening, we should promote hand hygiene as much as possible. So this is in terms of the use of proper hand washing and the use of 60% alcohol-based hand sanitizers whenever soap and water are not readily available. We should also limit the sharing of high-touch objects like electronic devices, pens and pencils, and other things. Proper use of disinfectants to clean high-touch surfaces and well-soiled areas. And proper waste cleanup and disposal with garbage bags and gloves. So in promoting healthy habits in schools, we should encourage physical activity, which improves the heart and lung health. It improves our endurance and stamina, strengthens the muscles and bones, and helps us with weight management. So the physical activity recommended for school-age children involves 60 minutes of daily aerobic exercise like walking and running, muscle and bone strengthening activities of 3 times a week, such as push-ups or lifting weights, and reduce screen time, as well as avoiding a sedentary lifestyle. So here are some examples of moderate physical activity, such as brisk walking of at least 4 miles per hour, heavy cleaning for washing windows, vacuuming or mopping, light effort in the bicycle, and recreational badminton. For examples of physical activity that would be classified as vigorous, we have hiking, jogging at 6 miles per hour, shoveling, carrying heavy loads, bicycling fast to up to 16 miles per hour, and playing basketball. So we have more apparent symptoms and concerns for mental health since the start of the pandemic. And here are some things that we can watch out for in our students. We have feelings of sadness, loneliness, or isolation, worsening peer pressure, depression, anxiety, increased risk-taking behavior like substance abuse, violence, and sexual risk-taking, suicide and self-harm, childhood behavioral disorders like attention deficit hyperactive disorder, and this will be discussed later, eating disorders like anorexia nervosa and bulimia nervosa, and psychosis, which could include hallucinations or delusions. So here are some checklists that may be present in students or staff, especially in this pandemic. If students feel worried, anxious, or frightened about their lockdown, or they seem like they're fatigued about having to continue online classes for a very long period of time. They worry about the future because of school closures. They worry about their family members, especially those who continue to report to work outside the house, or their constant fear of falling ill with the virus, as well as the deprivation and isolation of being unable to meet up or play or interact face to face with their friends. So during the return to face-to-face classes, we have several concerns from students and teachers and staff who may be nervous about having to return to face-to-face classes. They can worry about having to wear PPE in their class, having to wear a mask all day, difficulty in communication or interaction because they've been physically distanced for so long, and there's stress in adjusting or going back to their face-to-face routines pre-pandemic, but this time with a lot more PPE and administrative controls and engineering controls that will have to be in place. The PHQ-9 questionnaire is a quick tool that can be used to assess depression symptoms in adolescents. This can be scored and assessed by a trained professional. And so red flags are signs that a person may be having severe mental health difficulties and is in need of urgent help. These should be taken very seriously and should not be dismissed as acting out or as trivial. Students with these red flags should be referred to urgent care or to a specialist in child or adolescent psychology. So we can see that these red flags, like feelings of sadness that persist for 2 or more weeks, or talking about hurting oneself, or signs of self-harm, or death or suicide, should be referred to a child psychiatrist. So going to the key lessons of this lecture, one is that malnutrition, including undernutrition, overnutrition, or micronutrient imbalances, need to be screened and treated early to prevent poor health outcomes in students even later in life. Next, we should promote hygiene and sanitation in schools, and this requires several levels of intervention, including engineering and structural interventions, promoting behaviors towards proper hygiene, and providing the materials for good hygiene practices. Next, we should promote physical activity and change our sedentary lifestyle with excess screen time to eventually promote good health among our students. And last but not least, mental health may be a big concern during school reopening, and concerns in mental health may be prevalent. So our staff and teachers should be aware of our red flags that require an urgent referral to someone who is an expert in child and adolescent mental health.